I'm Dr. Thompson, Akwo, Ntuba, the Chief Editor of Health and Development Magazine, and we are at the ATS Global Health Pavilion. And with me is, what's your name?
Dr. Elina Burhan from Jakarta, Indonesia.
Nice to meet you, Doc.
Nice to meet you too.
What does your presence in this meeting benefit you?
I think by joining and participating in this Congress, I meet a lot of people from different countries and can share experience, and also I can learn a lot from different topic regarding pulmonary disease, and also seeing all the results of researches that is being enrolled in different settings.
Beautiful. They are not many women who are physicians or MDs, talk less of becoming an MD and then a PhD. So what are some of the obstacles that have been on your way, and how will you use them?
Well, there is not so much gender issue in my country in terms of education. Women and men can go can go to any school to get any education for any level in my country. There is no gender issue, and in fact, because I'm teaching also at the Faculty of Medicine, I found that the increasing number of girls in the university.
Right.
Maybe that was not so much previously, but nowadays the increasing number of girls and women in university.
So what aspect of respiratory or pulmonary work do you specialize in?
Pulmonary infection.
Oh, pulmonary infection.
Yeah. My interest in tuberculosis.
Tuberculosis?
Yeah.
So what is the prevalence and incidence in Indonesia?
Yeah.
And what is your national strategy and plan that is put in place to help bring about positive outcomes?
Well, our last prevalence survey shows that the increasing number of prevalence and also the incidence. The number of incidents right now is approximately 1 million new cases every year, and the prevalence is 1.6 million cases per year. And I think that's really alarming, especially if you do not find and diagnose them and treat them until they got cured, because then since TB is an infectious disease, then the infection will spread out and we got more and more TB cases. And Indonesia now ranks second after India, and I think we should more focus in finding the cases and treat them until they got cured. Otherwise, we'll be facing a new re-emerging problem, which is MDR tuberculosis, multi-drug resistance.
Thank you very much. Most of the physicians around the world involved in pulmonary tuberculosis work use 3, 2, or 4 of isoniazid, rifampicin, ethambutol, and streptomycin. In the different combinations that they use, the treatment regimen could go for as long as 6 months or up to 9 months, or some cases 1 year. So how do patients, who are not educated well, go about staying on medication for that long without stopping and coming up with antibiotic resistance problems?
Yeah, I think there need to be a comprehensive approach. So the providers or the health staff need to give a better education, so that patient will aware and realize that they need to be cured for a certain duration of treatment, and we need also to tell them what will happen if they do not complete the treatment, and we have to also make sure that they understand the problem of drug resistance. And for that, it's not only the responsibility of the medical staff, but also the community and also the family, to make sure that the patient taking the drug properly until the end of treatment.
Finally, there is now there's an HIV resurgence there's a TB resurgence that's related to HIV. So what is the HIV situation in Indonesia within the city or community where you practice, and how is that also influencing new cases of TB that you experience or deal with?
Well, the incidence of HIV also is increasing, but it's not similar in every part of Indonesia. It's usually in a big city. Yeah, and with the increasing number of HIV, meaning the increasing number also of TB. So we have to approach both sides, not only TB but also HIV. It needs a collaboration
in those
program.
two.
Yeah.